instance, you are, let's say you're driving down, let's say Abercorn Street, and you notice on the sidewalk here that you notice that somebody has collapsed to the ground. They look like they maybe have had a heart attack. So you pull over and get out the car, but before you approach that individual, you want to assess the scene. In any situation, if you see anybody collapse to the ground, the first thing you want to do before you approach that individual is assess the scene. Just make sure it's nothing dangerous on the ground, nothing slippery, electrical equipment, dangerous equipment, broken glass, things like that. You kind of want to remember safety first. Now, in reality, you're not going to always think about safety, especially if it's your spouse, significant other, one of your children, your parents, your siblings, or things like that. But just kind of remember in the back of your mind, safety first. Okay, so after you've assessed the scene, you want to approach the individual. And the first thing you want to do is check for responsiveness. You do that by tapping the shoulders and shouting, "Are you okay? Are you okay? Are you okay?" Next, you want to check for breathing. You want to check for breathing. You can watch the rise and fall of the chest, or you can put your ear to their mouth to listen for breathing. Now, if you hear anything like gasping, grunting, or wheezing, or anything out of the norm, any strange type of breathing, that's not normal breathing. That's like one of the first signs of cardiac arrest. So you kind of want to automatically get started with CPR right there. Next, you want to check for a pulse. With adults and children, you want to check the carotid pulse. Okay? So they're not responsive, they're not breathing, they don't have a pulse. Next, you want to activate the emergency response system. You do that by having someone to call 911 and get an AED. Or if you have your cell phone, you want to put it on speaker, dial 911 and put it on speaker so that the dispatcher can walk you through the steps and give you instructions until the rescue gets there. Okay, so beginning compressions. You want to use the palm of your hand. Place it in the lower part of the sternum, the breastbone. Interlock with the other hand. And we're going to do 30 compressions. We're going to press into the chest 2 inches at a rate of 100 to 120 compressions per minute. And you want to make sure that your elbows are locked in and your arms are straight. Okay, let's do 30 compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 1, 2, 3, 4, 6, 7, 8, 9, 30. Okay. That clicker is the feedback device that lets you know that you're going deep enough with the compressions. Now, also when you're doing the compressions, you want to always make sure that the chest comes back up and recoils to its normal position. That's called recoiling, and what it does, it gets blood going back to the heart and gets the heart back to refilling again with blood and gets the heart back to beating again. So each time you compress, let the chest come back up, recoil to its normal position. Compress, let it come back up and recoil to its normal position. Okay. Giving breaths. We're not going to give the actual breath. We're just going to tilt the head back and say 2 breaths. You're going to place your hand on the forehead, slightly pinch the nose, and you're going to place 2 fingers on the bony part of the chin, and you're going to tilt the head back and give 2 breaths. You always want to tilt the head back when you're giving breaths. That opens the airway and it gets air into the lungs. That's what we want. We want the air to get into the lungs. And also when you're giving breaths, you want to watch for the chest to rise. That's how you know you're giving effective breaths. Okay, any questions? Okay, let me demonstrate it one more time from the beginning. Okay, so I'm at the Savannah Mall. I'm walking through the mall, and up ahead I see a middle-aged gentleman that's collapsed to the ground, and his daughter is yelling for help. So we're gonna, before I approach that individual, I'm gonna assess the scene, make sure it's safe to approach. Okay, it's safe to approach. We're gonna approach the individual, check for responsiveness. Are you okay? Are you okay? Are you okay? I'm gonna check for breathing. Check for a pulse. He's not breathing, he's not responsive, he does not have a pulse. I'm gonna activate the emergency response system. Call 911, get an AED, begin compressions. 1, 2, 3, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 1, 2, 4, 5, 6, 7, 9, 30. 2 breaths. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 18, 19, 20, 1, 2, 4, 5, 6, 7, 8, 30. 2 breaths. Any questions? Okay, let's let you all stand. Let's do a practice. Okay, let's say you're out in your neighborhood let's say you're doing your morning jog, and up on the corner, the street corner here, you notice that somebody is collapsed to the ground. Looks like they apparently had a heart attack. So let's check for responsiveness. Assess the scene first.
Yeah.
Assess the scene.
Okay.
Okay, it's safe to approach the individual. Check for responsiveness.
You okay?
You okay?
You okay?
You okay?
Hey.
Okay, check for breathing, check for a pulse. Okay, they're not breathing, they're not responsive, they don't have a pulse. Activate the emergency response system. Begin compressions.
Okay.